Hi, my name is Derek Bourne. I teach English at Copino High School, and I am sick of the governor's inaction, lack of transparency around basic criteria that could get our schools restarted. It's ridiculous that we're sitting here months after this thing kicked in, and our basic knowledge about the disease hasn't changed that much, and yet he refuses to commit to clear criteria. So yes, we are here to demand science-based school reopening criteria to you, Governor Ducey. And what are those criteria? Downward trajectory of cases, low community spread, sufficient contact tracing and case investigation capabilities, and robust hospital capacity. Now, if you're already sold and you don't need to hear anything more because these are the kinds of things you already understand or believe that we should do, then you can just sign the petition to Governor Ducey right now. There's no need to watch this video unless you're just curious. Change.org/reopensafe. You don't need to capitalize the two letters of reopen safe, but you can. Either way is good. So yeah, please feel free. Just jump ahead and turn this crap off. But if you do want to just learn a little more about what criteria are being proposed, here we go. Where did I get them from? I didn't just make them up, because I'm an English teacher, not a scientist. So I went to the scientists, and this document from the CDC on the left was what the CDC put out in May to explain the White House reopening plan. Remember the phased reopening plan? This is the guidance for it. Lo and behold, it generated the four larger criteria above. The document on the right, this way. The document on the right is the World Health Organization, and this was their guidance to countries in terms of what things to consider and measure before you reopen. So we already have two formidable science-based organizations that did a lot of work to build out these guidelines. Let's go with those. So number one, we got downward trajectory. The Centers for Disease Control, CDC, says you should have a downward trajectory of cases within a 14-day period to get to phase one, and then meet it twice, a second time, for phase two. So let's take a look at that. Now, if you've been following the news at all, you know that Arizona is not even close to that kind of metric. In fact, we just became the number one state in the nation per capita for infections, beating New York for their all-time high of 509 cases per million on April 10th. We now have more than that, 528 cases per million as of today. Congratulations, Governor Ducey. Now, in the CDC document that I was mentioning a second ago, it says right in it, to transition into phase two, you have to achieve an additional 14 consecutive days of improvement without experiencing a rebound, defined below. And there it is. A rebound occurs when the average of case counts exhibits an increase over a 5 consecutive day period. Clearly, Arizona is in the middle of a huge rebound, as are many other states. And so we would have to go back and qualify for phase one before we could go into phase two, according to the CDC. Just saying. Now, another criteria, this is an OR, is a 14-day downward trajectory in percent positive test results, which again you'd have to meet twice to get to phase two and be safe to reopen schools, according to the White House plan. Well, just to give quick context, Arizona is leading the nation with 25% positive test results as of today from Johns Hopkins University. But that doesn't show, trend lines, so let's look at those. Now, I hate how this is presented on the Arizona dashboard, but you can see as we go to the far right, that is the most recent data. So if you go to the week ending 6/21, that's going to be the third dot from the right. We were at 21% positive with 110,000 tests done. And if you go to the second week, ending in 6/28, that's the second dot from the right, we were a little higher, 22% positive, although you can see that it looks like not all the tests are in yet, and you're going to see that trend continue. Now we're all the way to the right, the week that just ended yesterday, We were looking a little lower at 90% positive, but you can't take that to the bank yet because there's only 700 tests done instead of 100,000 or 50,000. So those tests will get reported. It's taking way too long right now, which is another thing the CDC recommends is you have to get testing turned around quickly. I think they said 3 days. Arizona's taking about a week right now. The point being, it's possible that the week that just ended might stay a little lower. Will that be week one of a trend? And then we would need to continue from there, qualify for phase one and then phase two. Now, this is kind of an Arizona-specific comment. The CDC said that declines in percent positive may result from an expansion of testing. So percent positivity should only be used as an indicator when per capita testing levels are stable. Governor Ducey ignored this very explicit advice from the CDC in declaring us to be in phase one in the first place because we were rapidly increasing our testing capacity at the time we qualified, and yet he managed to show that that was a decreasing percentage at that time, months ago, to declare us in phase one. That was the only criteria he said we met, but even the CDC disagrees with his interpretation. And by the way, a lot of governors fudge this data in terms of saying they were in phase one. So he's not alone there. And then moving over to the World Health Organization, they have some different criteria, some that overlaps, but they suggest an effective reproduction number, RT, of less than 1 for 2 weeks. That's the number that shows you how many people each person is infecting. So if it's less than 1, each person is infecting, less than one other person, you might still have spread, but it's going to decrease slowly over time. And our rate right now in Arizona is 1.09. So we are bending the curve in a good direction right now, but we are not underneath 1, and we would need to get that to meet, these World Health Organization criteria. Or you could decline from the recent peak of at least 50%, a decline of at least 50% over 3 weeks from the peak. Now, Arizona has not peaked yet, so we can't even really talk about this criteria until we peak, which hopefully is very soon. So my whole point with this is not to pick and choose. I'm not a scientist. I'm not an epidemiologist. But we have these two credible organizations that have put a lot of science into these recommendations, and what the demand is for Governor Ducey, if you're on board, is that he just pick one of these for this category and meet it, and that would be one benchmark to meet in order to move on. And he needs to declare these publicly. That's part of the demand at the petition. So that is downward trajectory. Oh, no, it's not. Also, a decline in COVID deaths for at least 3 weeks was another option that they gave. So looking at that, this is one of the few statistics that looks okay for Arizona. You see that on June 25th is that largest spike there, and we had the most deaths there. So it's been a couple weeks since then, but the deaths lag. The report of the deaths lag. So it's really hard to know if some of these recent dates are going to get filled in with more, and given the spike in hospitalizations, ventilators, intubations, and everything else, it'd be rather surprising if, unfortunately, those numbers don't catch up a bit, but we'll see. The point is to follow science and objective criteria. Right now it looks good there. We'll see. And then a last point from the CDC, they mention that a sustained downward trajectory in cases does not necessarily equate to a low disease burden, and that's why we're going to move to the second piece of our demand for Governor Ducey. Low community spread. If you start from a very high place, 5,000 cases a day, let's just say, and then you have a 2-week downward trajectory, if it's only a small downward trajectory, it's meaningless because you still have way too much spread in your community, too much transmission, and if you open schools with high community spread, it doesn't matter if your trajectory is down, you are creating super spreader type events, or a very high potential of them. So anyway, let's look at what the CDC recommends here. Near 0% positive tests. That's far from where we are, as you saw, 19-20% right now. That'd be a very strong criteria to meet. Or below 10 cases per 100,000 people in a given, state, county, or whatever, over a 2-week period, sustaining that very, very low spread over 2 weeks. This is their recommendations for the White House reopening guidelines. Now, as we know, Arizona is 500 cases per million. So if you want to make that out of 100,000, you knock a zero off. We're basically at 52 cases per 100,000, not 10. We are 5 times what the CDC recommends currently to reopen. And then if you look at it county by county on the Arizona dashboard, these are actually broken down by the 100,000 already, so that you don't have to do any math to change them. Look at that. There's not a single county that is even close to being in a position where they could think about reopening. Just not even by a long shot. Okay, so the last criteria they give, honestly, is weak, but it's something, and it'd be showing a percent positive of test results less than 20% positive for 14 days to get to phase 1. Then they suggest maintaining under 15% for 14 days to get to phase 2. That's when you reopen schools. Obviously, we're far from that in Arizona. And again, just to look at this real quick, those are the numbers that we have right now. So if this week that just happened held up, we would actually qualify for the first week ever, but still have 3 weeks to go, where it had to get then under 15% the final 2 of those weeks. So we're not close to being safe. And then the World Health Organization, they have one simple standard: less than 5% positive test results for at least 2 weeks. That is a wonderfully high bar, and we are just woefully far from being able to meet that. So the third of 4 overall demands is around sufficient contact tracing and investigation. Contact tracing and investigation is the process of calling the people who wants to get a positive test result. County Health does this, and then they get contacts of anybody else who's come into close contact with the infected person, and they urge them to self-quarantine. This is the only way to really clamp down and ensure that once you get things under control, they don't spread. And they give guidance in the CDC document that it should be implemented at 2 distinct points in an epidemic. First, early on, to stop transmission and prevent a larger outbreak. Oops, we missed that opportunity, unfortunately. But the second one is once the community enters the suppression phase. Arizona's not even there, but hopefully we'll be there soon. Numbers might come down. You do it before the mitigation measures are fully lifted. In other words, what did we do to mitigate? We closed schools, and we should not even lift the mitigation measures, like closing schools or opening bars or whatever, until we have contact tracing in place. So the first criteria from the CDC specifically is to be able to attempt initial interview for nearly all new cases within a day. You just have to be able to jump on this quickly as soon as there's a positive test result and let people know. Now, that goes back to my earlier point. If you don't get test results to people very, very quickly, the contact tracing doesn't do that much good. So it has to be part of a quick rapid response testing regime. Otherwise, people have already gotten pre-symptomatic, basically contributed to pre-symptomatic spread before they were ever notified that they were infected. And you have to be sufficient capacity for follow-up, which means isolation, self-monitoring, testing if symptomatic for nearly all of their close contacts, which is the other piece and the contact tracing element of this. So where are we at? The CDC had some other guidance that was about doing case investigation and contact tracing. So I took a look at that, and in there they linked an Excel document you could use as a tool to estimate how many contact tracers you would need given your number of infections. So I took the 7-day average in Arizona of how many new cases per day, which is that circled number 3844. That's our average new cases per day right now. And I used all of their most the CDC's most conservative guidelines. I copy them all directly from them in terms of how many of these people are easy to reach, who's harder to reach. I used all their ratios for everything else for the easiest plan that they recommended. And I got that we would need in Arizona 14,000 contact tracers working full-time, 40 hours a week, in order to effectively do this work. Which goes to show why once it's a pandemic, you don't worry about contact tracing, but as soon as you get it under control, you bring it back in to make sure that it doesn't get worse from there. So 14,000 is what we would need, the CDC says. Where does Arizona stand? As the Copper Courier says, we don't know. Now this was May 7th, about 2 months ago, but I've read articles much more recently that still indicate a huge lag. Now what they did find in that article was, first of all, the Arizona Department of Health Services didn't return a request for the numbers, and they haven't to date to anyone, as far as I've heard. And multiple Arizona counties didn't return any inquiries about the number of contact tracers they had. But a spokesman from Maricopa County did, so we'll just go with this for now. They said they currently had 25 people. They had plans to hire and train about 50 contact tracers by the end of June. Well, it's only barely past that. So let's just assume they now have 75, a full complement, according to what they were aiming for. They have a population of 4.5 million in that county. In Arizona, it's 7.3 million. So they are 61% of the population of this state, yet their 75 contact tracers is 0.5% of the 14,000 recommended. Just to give you some little back of the napkin idea of how just insanely out of whack we are in terms of following health guidelines by public health officials. And I spoke to a person at Coconino County Health today, and she told me that basically the state has refused to give the county folks any guidelines about when would you shut down schools? Why would you? How many cases would it take? She was very frustrated, and she said they've been given no guidance whatsoever, not a single number, not a sentence that they can hang their hat on, and they don't know what to tell local school districts and school boards about how they're going to keep people safe or what the state may demand of them. And that's why this petition is going straight to Ducey. He's the only one with his executive orders that created this mess and that refuses to be transparent, and the only one who can fix it. So the World Health Organization says, similar, at least 80% of new cases have their close contacts traced and in quarantine within 72 hours, monitored for 14 days. So theirs is a little more specific and maybe a little more lenient, but it still shows you how important this really is to do in a timely fashion. Okay, so finally the fourth category here, robust hospital capacity. And the Centers for Disease Control says inpatient and ICU beds should be less than 80% full for a week to get to phase 1, and then less than 75% full for another 7 days to get to phase 2. So this is one of the few that you can go all the way from nowhere to phase 2 in just 2 weeks if you hit your targets. So let's look at Arizona. Our inpatient bed use is at 82%, so that's not going to cut it. And our intensive care bed use is 90%, and both of these are very high relative to anywhere they've ever been, and high relative to the recommendations of safety. Then another thing you could use, according to the CDC, again, these are all ORs, these bullets, 14-day downward trajectory of emergency department visits for COVID-like illness, again, after entering phase 1 without a rebound. I'll just stress that again. And our emergency department visits actually appear possibly to have peaked. We'll see. But that was just, 5 days ago? And so we have ways to go to make sure that we really are on a trajectory. Is this just a blip? It's hard to say right now. So the World Health Organization Similar but slightly different criteria. Decline in the number of hospitalizations and ICU admissions for at least 2 weeks. So let's look at hospitalizations related to COVID. And here, again, is one of the few places that looks good. On June 15th, a good, 3 weeks ago or so, was our peak for that, with 99 hospitalizations for COVID that day. But as you see at the top, we're missing the hospitalization status of 63% of cases, meaning we don't know either way whether they're in or out. And so, again, we talk about the data lag in these numbers. It's just hard to know, but this may somehow be a good sign, though it's hard to imagine how that squares with all the other numbers that are going up, like intubations and ventilator use and stuff. So that is my presentation. Are you sick of bad governance? Because let me be really clear, good governance is transparent whenever it can be. Good governance is accountable to the people and the citizenry, and that is not what we're seeing with this. We have heard nothing except for that he was willing to delay the school year until August 17th. Why? Only the vague statements that we're going in the wrong direction. Well, yeah, that was pretty clear and quite an understatement, but what were the criteria? What would he need to see change for us to get back? As our governor, he owes it to the people not to keep that close to his vest. It deserves public scrutiny and examination and debate. Once he puts out criteria, reporters should be able to ask him about them. Where did you get them from? And, hopefully he picks these ones from a respected institution like the CDC or the World Health Organization, so he can easily know that he did what the best minds thinking about this have recommended. Please sign the petition, and don't just sign it. Get other people to sign it. We need this to go to community members, educators, school staff, politicians, community leaders of any kind, everybody that you know who is sick of this nonsense and the uncertainty. Schools have so much good work to do to plan for next year, and as soon as we know there's clear criteria, we will then know, okay, we won't be able to do in-person learning for a while. And I would hope if the governor would commit to following reasonable criteria like this, he would also probably immediately announce the suspension of school for at least the first quarter, so districts and staff and families and everybody else can get to the hard work of figuring out what's next. And obviously the governor and the legislature might have to play a role in that too, to figure out childcare needs or other considerations that may have to be part of this. But the fact is, we can't have schools as super spreader events during a pandemic that is at a very merciless level of outbreak right now. It's going to be the blood of our community on your hands, Governor Ducey. So please don't let that happen. Please listen to the people of Arizona, and y'all who are watching, please sign the petition. Change.org/reopensafe. Thank you for watching.